this video of mine is about Alzheimer's disease. Well, it's a progressive neurological disorder that causes the brain to shrink, the brain atrophies and the brain cells start dying. Alzheimer's disease is the most common cause of dementia, which is a continuous decline in thinking, behavioral and social skills that affect a person's ability to function independently. Out of the approximately 50 million people worldwide with dementia, between 60 to 70% are estimated to have Alzheimer's disease. The early signs of the disease include forgetting recent events or conversations. As the disease progresses, a person with Alzheimer's disease will develop severe memory impairment and lose the ability to carry out everyday tasks. Medication may temporarily improve a slow progression of symptoms. These treatments can sometimes help people with Alzheimer's disease maximize function and maintain independence for a time. Different programs and services can help support people with Alzheimer's disease and their caregivers. There is no treatment that cures Alzheimer's disease or alters the disease process in the brain. And advanced stages of the disease, complications from severe loss of brain function such as dehydration, malnutrition or infection result in death. Earlier on this channel, I already posted a short video about Alzheimer's disease. I hope you have already seen that, and today I am going to discuss this illness in detail. This is a very important video because Alzheimer's disease is very common. So listen carefully. Okay, first of all, let me tell you the symptoms. Memory loss is the key symptom of Alzheimer's disease. Early signs include difficulty remembering recent events or conversation. As the disease progresses, memory impairments worsen and other symptoms develop. At first, a person with Alzheimer's disease may be aware of having difficulty remembering things and organizing thoughts. A family member or friend may be more likely to notice how the symptoms worsen. Brain changes associated with Alzheimer's disease lead to growing trouble with memory. Well, everyone has occasional memory lapses, but the memory loss associated with Alzheimer's disease persists and worsens, affecting the ability to function at work or at home. People with Alzheimer's may repeat statements and questions over and over, forget conversations, appointments or events and not remember them later. Routinely misplace possessions, often putting them in illogical locations. Get lost in familiar places. Eventually forget the names of family members and everyday objects. Have trouble finding the right words to identify objects, express thoughts or take part in conversations. Thinking and reasoning. Well, Alzheimer's disease causes difficulty concentrating and thinking, especially about abstract concepts such as numbers. Multitasking is especially difficult and it may be challenging to manage finances, balance checkbooks and pay bills on time. Eventually, a person with Alzheimer's may be unable to recognize and deal with numbers. Making adjustments and decisions. Well, Alzheimer's disease is a decline in the ability to make reasonable decisions and judgments in everyday situations. For example, a person may make poor or uncharacteristic choices in social interactions or wear clothes that are inappropriate for the weather. It may be more difficult to respond effectively to everyday problems such as food burning on the stove or unexpected driving situations. Also, there could be changes in planning and performing familiar tasks. Once routine activities that require sequential steps such as planning and cooking a meal or playing a favorite game become a struggle as the disease progresses. Eventually, people with advanced Alzheimer's often forget how to perform basic tasks such as dressing and taking bath. Changes in personality and behavior. Brain changes that occur in Alzheimer's disease can affect moods and behaviors. Problems may include the depressions, apathy, social withdrawal, mood swings, distrust in others, irritability and aggressiveness, changes in sleeping habits, wandering, loss of inhibitions, delusions such as believing something has been stolen. And now I'll tell you some about preserved skills. Well, many important skills are preserved for longer periods even while symptoms worsen. Preserved skills may include reading or listening to books, telling stories and reminiscing, singing, listening to music, dancing, drawing or doing crafts. These skills may be preserved longer because they are controlled by parts of the brain affected later in the course of the disease. A number of conditions, including treatable conditions, can result in memory loss or other dementia symptoms. If you are concerned about your memory or other thinking skills, you should talk to your doctor for a thorough assessment and diagnosis. If you are concerned about thinking skills you observe in a family member or friend, talk about your concerns, and ask about going together to a doctor's appointment. Okay, now I'll tell you the causes. The exact cause of Alzheimer's disease are not, the exact causes of Alzheimer's disease are not fully understood, but at a basic level, brain proteins fail to function normally, which disrupts the work of brain cells. The work of neurons, which are the brain cells of are affected. Okay, and they are disrupted. And this triggers a series of toxic events. When neurons are damaged, lose connection to each other, and then they eventually die. Scientists believe that for most people, Alzheimer's disease is caused by a combination of genetic, lifestyle, and environmental factors that affect the brain over time. Less than 1% of the time, Alzheimer's is caused by specific genetic changes that virtually guarantee a person will develop the disease. These rare occurrences usually result in disease onset in middle age. The damage most often starts in the region of the brain that controls memory, but the process begins years before the first symptoms. The loss of neurons spreads in a somewhat predictable pattern to other. The loss of neurons spreads in a somewhat predictable pattern to other regions of the brain. By the late stage of the disease, the brain has shrunk significantly. Researchers trying to understand the cause of Alzheimer's disease are focused on the role of two proteins. The first is plaques. Beta amyloid is a fragment of a larger protein. When these fragments cluster together, they appear to have a toxic effect on neurons and to disrupt cell-to-cell communication. These clusters form large deposits called amyloid plaques, which also include other cellular debris. Tangles. Tau proteins play a part in a neuron's internal port and transport system to carry nutrients and other essential materials. In Alzheimer's disease, tau proteins change shape and organize themselves into structures called neurofibrillary tangles. These tangles disrupt the transport system and are toxic to the cells. Okay, now I'll tell you some risk factors. The first is age. Increasing age is the greatest known risk factor for Alzheimer's disease. Alzheimer's is not a part of normal aging, but as you grow older, the likelihood of developing Alzheimer's disease increases. Okay. One study found that annually there were 4 new diagnoses per 1,000 people aged 65 to 74, 32 new diagnoses per 1,000 people aged 75 to 84, and 76 new diagnoses per 1,000 people aged 85 and older. Family history and genetics. Your risk of developing Alzheimer's somewhat is higher if a first degree relative, your parent or sibling, has the disease. Most genetic mechanisms of Alzheimer's among family remain largely unexplained, and the genetic factors are likely complex. One better understood genetic factor is the form of apolipoprotein E gene. A variation of the gene ApoE4 increases the risk of Alzheimer's disease. Okay. Then another risk factor is Down syndrome. Many people with Down syndrome develop Alzheimer's disease. This is likely related to having 3 copies of chromosome 21 and subsequently 3 copies of the gene for the protein that leads to creation of beta amyloid. Signs and symptoms of Alzheimer's disease tend to appear 10 to 20 years earlier in people with Down syndrome than they do for the general population. Sex. There appears to be little difference in risk between men and women, but overall there are more women with the disease because they generally live longer than men. Then another risk factor is mild cognitive impairment, MCI. This is a decline in memory or other thinking skill that is greater than normal for a person's age, but the decline doesn't prevent a person from functioning in social or work environments. People who have MCI have a significant risk of developing dementia. When the primary MCI deficit is memory, the condition is more likely to progress to dementia due to Alzheimer's disease. Head trauma. People who have had a severe head trauma have a greater risk of Alzheimer's disease. Several large studies found that in people aged 50 years or older who have a traumatic brain injury, the risk of dementia and Alzheimer's disease increased. Thus, the risk increases in people with more severe and multiple TBIs, traumatic brain injury. Some studies indicate that the risk may be greatest within the first 6 months to 2 years after the traumatic brain injury. Okay. Air pollution. Studies in animals have indicated that air pollution particulates can spread degeneration of the nervous system and human studies have found that air pollution exposure, particularly from traffic exhaust and burning wood, is associated with the greater dementia risk. Excessive alcohol consumption. Drinking large amounts of alcohol has long been known to cause brain changes. Several large studies and reviews found that alcohol use disorders were linked to increased risk of dementia, particularly early onset dementia. Poor sleep patterns. Researchers have shown that poor sleep patterns such as difficulty falling asleep or staying asleep are associated with an increased risk of Alzheimer's disease. Lifestyle and heart health. Research has shown that the same risk factors associated with heart disease may also increase the risk of Alzheimer's disease. These include lack of exercise, obesity, smoking or exposure to second-hand smoke, high blood pressure, high cholesterol, poorly controlled type 2 diabetes. Well, on this channel there are very informative videos about diabetes. There are 4 videos in Urdu language and 2 in English. You can see those videos, they are very informative. Okay. Well, all of the factors which I have just told you can be modified. Therefore, changing lifestyle habits can to some degree alter your risk. For example, regular exercise and a healthy low-fat diet, rich in fruits and vegetables, are associated with a decreased risk of developing Alzheimer's disease. Then comes lifelong learning and social engagement. Studies have found an association between lifelong involvement in mentally and socially stimulating activities and a reduced risk of Alzheimer's disease. Low education level, less than a high school education, appear to be a risk factor for Alzheimer's disease. Complications. Memory and now I'll tell you the complications of Alzheimer's disease. Well, memory and language loss, impaired judgment, and other cognitive changes caused by Alzheimer's can complicate treatment for other health conditions. A person with Alzheimer's disease may not be able to communicate that he or she is experiencing pain, experience symptoms of another illness, follow a prescribed treatment plan, explain medication side effects. As Alzheimer's disease progresses to its last stages, brain changes begin to affect physical functions such as swallowing, balance, and bowel and bladder control. These effects can increase vulnerability to additional health problems such as inhaling food or liquid into the lung that leads to aspiration pneumonia, flu, pneumonia, and other infections, falls, fractures, bed sores, malnutrition or dehydration, constipation or diarrhea, dental problems such as mouth sores or tooth decay. So these are the complications of Alzheimer's disease. Now I'll tell you some preventive measures. Well, Alzheimer's disease is not a preventable condition. However, a number of lifestyle risk factors for Alzheimer's disease can be modified. Evidence suggests that changes in diet, exercise, and habits and steps to reduce the risk of cardiovascular disease may also lower your risk of developing Alzheimer's disease and other disorders that cause dementia. Heart healthy lifestyle choices that may reduce the risk of Alzheimer's include exercising regularly, eating a diet of fresh produce, healthy oils and foods low in saturated fat such as a Mediterranean diet, following treatment guidelines to manage high blood pressure, diabetes, and high cholesterol, asking your doctor for help to quit smoking if you smoke. Studies have shown that preserved thinking skills later in the life and a reduced risk of Alzheimer's disease are associated with participating in social events, reading, dancing, playing board games, creating art, playing an instrument, and other activities that require mental and social engagement. Now I will tell you about the diagnosis of Alzheimer's disease. Well, when patients come to us, an important part of diagnosing Alzheimer's disease includes being able to explain your symptoms as well as perspective from a close family member or friend about symptoms and how they impact your life. Additionally, a diagnosis of Alzheimer's disease is based on tests your doctor administers to assess memory and thinking skills. Lab and imaging tests can rule out other potential causes or help the doctor better identify the disease-causing dementia symptoms. Traditionally, Alzheimer's disease was only diagnosed with complete certainty after death when examined the brain with a microscope, revealed the characteristic plaques and tangles. Clinicians and researchers are now able to diagnose Alzheimer's disease during life with more certainty. Biomarkers can detect the presence of plaques and tangles such as specific types of PET scans or measuring amyloid and tau protein in plasma and cerebrospinal fluid, CSF. Now I'll discuss some tests. Well, a diagnostic workup would likely include the test that the first is, of course, the physical and neurological exam. Your doctor will perform a physical exam and likely assess overall neurological health by testing the reflexes, muscle tone and strength, ability to get up from a chair and walk across the room, sense of sight and hearing, coordination and balance. Lab test. Blood test may help your doctor rule out other potential causes of memory loss and confusion, such as a thyroid disorder or vitamin deficiencies. Mental status and neurophysiological testing. Your doctor may give you a brief mental status test to assess memory and other thinking skill. Longer forms of neuropsychological testing may provide additional details about mental function compared with people of the similar age and education level. These tests can help establish a diagnosis and serve as a starting point to track the progression of symptoms in the future. Brain imaging. Images of the brain are now used chiefly to pinpoint visible abnormalities related to conditions other than Alzheimer's disease, such as strokes, trauma, or tumor. They may cause the cognitive changes. Now, new imaging applications currently used primarily in major centers or in clinical trials may enable doctors to detect specific brain changes caused by Alzheimer. Imaging of the brain structure includes the magnetic resonance imaging. MRI uses radio waves and a strong magnetic field to produce detailed images of the brain. While they may show brain shrinkage of brain regions associated with Alzheimer's disease, MRI scans also rule out other conditions. An MRI is generally preferred to a CT scan for the evaluation of dementia. CT scan. Specialized X-ray technology produces cross-sectional images, slices of your brain. It is usually used to rule out tumors, strokes, and head injuries. Imaging of the disease process can also be performed through positron emission tomography, PET scan. During a PET scan, a low-level radioactive tracer is injected into the blood to reveal a particular feature in the brain. PET scanning may include fluorodeoxyglucose (FDG) PET scan and amyloid PET imaging. It can also include tau PET imaging. There are some future diagnostic tests. Researchers are working to develop tests that can measure biological signs of disease processes in the brain. These tests include blood tests may improve the accuracy of diagnosis and enable earlier diagnosis before the onset of symptoms. A blood test for plasma A beta is currently available and recently received certification in the US by Center of Medicare and Medical Services to allow distribution on the market. Okay. Now I'll discuss treatment options. First of all, drugs. Current Alzheimer's medication can help for a time with memory symptoms and other cognitive changes. Two types of drugs are currently used to treat cognitive symptoms. These are first group is cholinesterase inhibitors. These drugs work by boosting level of cell-to-cell communication by preserving a chemical messenger that is depleted in the brain by Alzheimer's disease. These are usually the first medication tried, and most people see modest improvements in symptoms. Cholinesterase inhibitor may also improve neuropsychiatric complications. Cholinesterase inhibitor may also improve neuropsychiatric symptoms such as agitation or depression. Commonly prescribed cholinesterase inhibitors include donazepam, that comes with the name of Aricept, galantamine, and that comes with the name of Rezardine ER, and rivastigmine, that comes with the name of Exelon. The main side effects of these drugs include diarrhea, nausea, loss of appetite, and sleep disturbance. In people with certain heart disorders, serious side effects may include the cardiac rhythm. The next group of drugs is memantine, that comes with the name of Namenda. This drug works in another brain cell communication network and slows the progress of symptoms with moderate to severe Alzheimer's disease. It's sometimes used in combination with a cholinesterase inhibitor. Relatively rare side effects include dizziness and confusion. In June 2021, the Food and Drug Administration, FDA, approved aducanumab, that comes with the name of Adulam, for the treatment of some cases of Alzheimer's disease. This is the first drug approved in the United States to treat the underlying cause of Alzheimer's by targeting and removing amyloid plaques in the brain. The FDA approved the drug on the condition that further studies be conducted to confirm the drug's benefit. Okay. Then we have to create a safe and supporting environment for Alzheimer's patients. Adapting the living situation to the needs of the person with Alzheimer's disease is an important part of any treatment plan. For someone with Alzheimer's disease, establishing and strengthening Routine habits and minimizing memory demanding risk can make life much easier. You can take some steps to support a person's sense of well-being and continued ability to function. Well, first, here I'll tell you some steps. Always keep keys, wallets, mobile phone, and other valuables in the same place at a time, in the same place at home, so they don't become lost. Keep medication in a secure location. Use a daily checklist to keep track of dosages. Arrange for finances to be an automatic payment and automatic deposit. Have the person with Alzheimer carry a mobile phone with location capability so that a caregiver can track his location. Program important phone numbers into the phone. Install alarm sensors and on doors and windows. Make sure regular appointments are on the way. Make sure regular appointments are on the same day at the same time as much as possible. Use a calendar or whiteboard in the home to track daily schedule. Build the habit of checking of completed terms. Remove excess furniture, clutter, and throw rugs. Install sturdy handouts on a stairway and in bathroom. Ensure that shoes and slippers are comfortable and provide good traction. Reduce the number of mirrors. People with Alzheimer may find images in mirrors as confusing and frightening. Make sure that the person with Alzheimer's disease carries identification to or via the medical alert bracelet. Key thoughts and keep photograph and other meaningful objects around the house. Okay, now I'll tell you something about alternative medicine. Well, various herbal remedies, vitamins, and other supplements are widely promoted as a preparation that may support cognitive health or prevent or delay Alzheimer's. Clinical trials have produced mixed results with little evidence to support them as an effective treatment. Some of the treatments that may have been studied include vitamin E. Although vitamin E doesn't prevent Alzheimer's, taking 2,000 international units daily may help delay the progression in some people who already have mild to moderate disease. However, study results have been mixed, with only some showing modest results. Further research into the safety of 2,000 international units daily of vitamin E in a dementia population will be needed before it can be routinely recommended. Supplements promoted for cognitive health can interact with the medication you are taking for Alzheimer's disease or other health conditions. Work closely with your healthcare team to create a safe treatment plan with any prescription, over-the-counter medication, or dietary supplements. Omega-3 fatty acids. Omega-3 fatty acids in fish or farm supplements may lower the risk of developing dementia, but clinical studies have shown no benefit for treating Alzheimer's disease symptoms. Curcumin. The herb this curcumin herb comes from turmeric and has anti-inflammatory and antioxidant properties that might affect chemical processes in the brain. So far, clinical trials have found no benefit for treating Alzheimer's disease. Ginkgo. Ginkgo is a plant extract containing several medicinal properties. A large study found that by the National Institute of Health found no effect in preventing or delaying Alzheimer's disease. Melatonin. This supplement of hormone that regulates sleep is being studied to determine if it offers benefit managing sleep in people with dementia. But some research has indicated that melatonin may worsen mood in some people with dementia. More research is needed. Now I'll tell you some lifestyle and home remedies. Well, healthy lifestyle promotes good health, good overall health, and play an important role in maintaining cognitive health. Exercise. Regular exercise is an important part of the treatment plan. Activities such as daily tasks can help improve mood and maintain the health of the joints, muscles, and the heart. Exercise can also promote useful sleep and prevent constipation. It is believed and it is benefit for care partner too. People with Alzheimer's who develop trouble walking may still be able to use a stationary bike, stretch with the elastic bands, or participate in chair exercise. You may find exercise program geared to older adults on TV or on DVDs. Nutrition. People with Alzheimer may forget to eat, lose interest in preparing meals, or not eat a daily the combination of foods. They may also forget to drink enough, leading to dehydration and constipation. In these cases, you should offer these choices which I am going to tell you. Healthy option: buy favorite healthy food options that are easy to eat, water and other healthy beverages. Encourage drinking several glasses of liquid every day. Avoid beverages with caffeine, which can increase restlessness, interfere with sleep, and trigger a frequent need to urinate. High calorie healthy shakes and smoothies. Supplement milkshakes with protein powder or make smoothies featuring favorite ingredients, especially when eating becomes more difficult. Social engagement and activities. Social interaction and activities can support the abilities and skills that are preserved. Doing things that are meaningful and enjoyable are a part of the treatment overall for a person with Alzheimer's disease. These might include listening to music or dancing, reading or listening to books, gardening or crafts, social events or senior or memory care sessions, planned activities with children. Okay, so this was my video about Alzheimer's disease. I hope you like this video. If you have any question about this illness, please let me know in the comment section, and as soon as I find a time, I'll try to answer your questions. Okay, thanks for watching this video. See you in next video. Bye for now.